Recording in progress.
Ma'am, we are live now.
Okay, thank you. Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Quiz organized by Fever Foundation. Before we start, I just would like to just brief you all about the Fever Foundation. Fever Foundation is an independent, non-commercial foundation supporting the educational and academic activities. And this is to address the unmet needs in fever management. The Fever Foundation is committed to conceive, build, and sustain program and to make scientific initiatives which are aimed at providing evidence-based update to healthcare professionals. The vision of Fever Foundation includes to strive towards imparting knowledge on the unmet needs and provide information on research, education, therapy updates on fever management. The Fever Foundation activities include annual fever conferences, fever CME, books on fever management, clinical and epidemiological research, challenging case presentation competition for postgraduate, young scholar awards, patient education, paramedical education, public awareness activities. And we also did some special activity this month, in this year, in the month of May. We celebrated Fever Week between 24th to 30th May. It's the first time in India and the first time in the world Fever Week was conducted. This was to commemorate the birth anniversary of Sir Gabriel Fahrenheit, who invented thermometer and Fahrenheit scale. And during that period, we had mega seminars, national panel discussion on 24th May for pediatrician, 25th May for physician. And also, we had a lot of CME programs during that week. More than 100 programs were planned and conducted during that week. And we had patient education, public education activity. It was, I should thank our eminent advisory board members. All the members helped us in conducting this patient and public education activity. And they helped us in creating through awareness through FM radio in the regional languages. Thanks to them. Then we also started fever research activity. The first original research activity was initiated and it's going on at Ellen Medical College, Bhopal. And as a part of Fever Foundation and FEFCON, we every year we do PG quiz for postgraduates in medicine and pediatrics. There will be 4 zonal quiz, which already started. We are on day 3, 23, 24, 25th, and 26th July. The pediatrics, we have it at 4 o'clock, and for physician at 7 p.m. And we do have poster presentation competition, both in pediatrics and medicine. The last date for submission of the poster is 10 September. This poster has to be related to fever. It can be case studies or original research. Poster presentation competition will be held on 17th or 18th of October. And we have developed fever training manual and a certificate course for general practitioner and family physician will be rolled out soon. So I take this opportunity to welcome you all to FEFCON 2024, which is the 7th annual national conference of Fever Foundation of India. So we will have really exciting scientific session. We will be having eminent speakers across India who will come and discuss. It is a across specialty kind of program where physician, pediatricians, infectious disease, critical care specialists, microbiologists, pathologists, everyone who is involved in the fever management will come and epidemiologist and will come under one roof and then discuss about management and the challenges of management of fever. So please mark it is 23rd and 24th of November. We will be sharing all the details to you as well as it will be notified in your college notice boards as well. So, I before I start, I would have the pleasure and the privilege of introducing the quiz faculties for today. Today we have a quiz host, Dr. Anupam Prakash. Sir is MBBS, MD General Medicine and PGCC Hospital Management, and he has done several other courses. Currently, Sir is the Director and Professor of Medicine and Head of the Department of Accident and Emergency at Lady Hardington Medical College and Associated Hospital, New Delhi. Sir is editor-in-chief in Indian Journal of Medical Specialties. Associate Editor of API Textbook of Medicine, member of Governing Council of API, President Board Management of Delhi Diabetic Forum, President Indian Society of Atherosclerosis and Research, Vice Chairman of API Delhi State Chapter, and member of Advisory Board of JAPI, JICM and Journal Case Report. And sir is also founder member of advisory board for Fever Foundation. They help us in conducting all the scientific activity. So Dr.
Thank you,
Welcome,
Dr.
sir.
Manjula. Thank you.
Welcome, sir. Thank you, sir.
Thank you.
Then we have quiz master today, Dr. Shubhalakshmi Margekar ma'am. She is the professor at the Department of Medicine at Lady Hardinge Medical College. She is a fellow of Indian College of Physicians, fellow of Association of Clinical Medicine, and fellow of EPDA and fellow of ISAR. Madam is a recipient of prestigious Dr. J.C. Patel and Dr. B.C. Mehta Award in Epicon, both in 14 and recently 2024 as well. She is faculty in various state and national conferences and CME. She's organizing a team member in various CME and conferences, delivered lectures in Epicon, Diabicon, and various national and international CMEs. She has participated in several multicentric international and the national clinical trials, and she has more than 65 publications in various national and the peer-reviewed journals and 15 chapters in textbooks of API medicine and the medicine update. And she's also in charge of Thalassemia Adult Daycare Center and Thalassemia Transition Care Center at Lady Hardinge Medical College. Dr. Shubhalakshmi, madam, welcome to you. Thanks for accepting the quiz master. And I must say that Dr. Shubhalakshmi and the entire team of Lady Hardinge Medical College, Dr. Ramesh Agarwal, Dr. Ampam sir and Gansham sir has been helping us in conducting these quizzes for the past 6 years. This is the 7th year. Thank you very much, sir and madam. So we have two subject experts with us, Dr. Gansham Pankte sir. He's a professor of medicine at Lady Hardinge Medical College, and Dr. Ramesh Agarwal sir, professor Department of Medical Medicine at the Lady Hardinge Medical College. So thank you very much for both of you joining and accepting
Thank you,
our
madam.
expert.
Thank you,
Thank you.
madam.
Welcome,
Thank you.
sir. Welcome, sir. So before we start, I would like to tell the rules and regulation for the participants. Oh, sorry. The most important member I was missing is the jury. We have a very strict jury with us. And is known to me for many, many years. So I take the liberty of saying that sir is the quiz jury. MK Professor MK Sudarshan sir. Sir is also founder member of advisory board of your foundation. Sir has been the ex-director and retired dean, principal, and the professor of HOD of Community Medicine, Kempegowda Institute of Medical Sciences, Bangalore. Sir is the chairman of State COVID Technical Advisory Committee, Government of Karnataka from 2020 to 2023. Chairman of WHO Southeast Asia region for the Rabies Technical Advisory Group at Delhi, and a member of National Technical Advisory Group of Rabies Government of India, and he has been the NABH Principal Assessor for Ethics Committee and Clinical Trials in New Delhi, and he is
Madam,
also
you can cut short. We can cut short and proceed with the quiz. Thank you, madam. Thank you. Thank you. Thank
thank
you.
you, sir.
Thank you.
Thank you so much, sir. Welcome to you, and I welcome and accepting to be
Yeah.
the jury, sir. Thank you, sir. Sir is also helping us jury for the past several years to helping us conducting the quiz in the very fair manner. Thank you, sir. So going on to the rules and regulations of the quiz. The quiz is for postgraduates only. The quiz consists of multiple choice questions. There will be 15 seconds to answer each question. The option to be selected by clicking on the button on the text panel. The video display with option will be only for representation purpose. I repeat, the video which you see is only for representation. You cannot select the answer, click it. You need to select the text below the video. The option has to be selected, and by clicking the submit button on the text panel, only your answer or your response will be recorded. So video display is only for representation. The participants are advised not to leave the platform. Once this answer is submitted, it will not be possible to revert. There is no negative marking. The winner will be the maximum fast right answer. So you have to be really fast and maximum right answer. If there is tie, the tiebreaker round will be done to decide the winner. And it's advisable to use laptop or desktop, and it should not use mobile phone for getting the answers from any colleague or sitting nearby. And Fever Foundation is not responsible for any form of technical error such as poor net connectivity. Participation in the quiz implies that the participants accept the integrity of these rules and the participants who have given incomplete or inaccurate personal or contact details will be disqualified. Non-compliance with the rules results in automatic cancellation of the participant in the quiz and the candidacy for the prize. First and second winner of each zone will enter into national level quiz competition, which will be held at FEFCON 2024, which is scheduled in November 2024. Lastly, the quiz masters and judges or jury's decision will be final, and all of us have to abide by this. So, with this, I wish you all a good luck and all the best for the quiz, exciting round of quiz. And now I'm handing over the session to quiz host, Dr. Anupam sir. Over to you, sir. Thank you.
Well, thank you, Dr. Manjula. It has been a privilege to be here. Welcome, Mr. Mahadev also. Girish Mahadev is here, and thank you. So we thank the Fever Foundation for their efforts and continuous efforts for conducting this for the 7th consecutive year. And we are sure, obviously, with Dr. Sudarshan and the team there, we will be able to conduct the quiz for year after year with newer people around and newer winners also, because we had some common winners this time, but that is also part of the game. So people have to be more competitive. So just talking about competition, the main purpose of asking postgraduates is you are at the beginning of the career, and it is important that you not only have knowledge excellence, but also you should be able to answer promptly. So the fastest finger, the right answer, and the earliest right answer you get the reward. So this is important because in life scenarios as well as in emergencies, you will need to answer or take decisions in a split second. So that is important. So that is why these types of quizzes are important, and they give you a platform also, a good exposure and platform for future avenues. So participation is very important. So I welcome all of you and congratulate also at the same time that yes, you are participating in a quiz which is a nationwide quiz, and it will give you an opportunity for participation. And as Dr. Manjula already said, or will say that yes, each participant will get a certificate of participation. So today she didn't say, she has been saying this for the last 2 days. So it happens. So you
I
all
will say
will be
last.
so that is okay, that is fine. So with this, we also have Dr. Sudarshan, who has been a mentor in this program and has been jury for last several years, and he's a very senior professor. And you must have seen that he asked not to discuss the whole slide because he has been a stalwart and it would take a lot of time to read his credentials. But I will request him to bless not only us, but also the participants with his experience. A couple of words, Dr. Sudarshan, sir. I hand over the mic to you, sir.
Yeah. So thank you very much, Dr. Anupam Prakash. And it gives me great pleasure to be in the midst of youngsters and also learn or update my knowledge of internal medicine through this quiz. And I see with what enthusiasm, interest, and passion this entire program is being run, and that also instills some joy in me. And I'm very happy to be associated with this PG quiz year after year. And as a jury, I wish I do not get any specific thing to do, because everything I wish should go on smoothly and nicely and finely. So with this, it is back to Dr. Anupam Prakash, Dr. Manjula, and others. Please. Over. Thank you.
Well, thank you. Thank you so much, sir, for the kind words. So I straightway hand over the mic to Dr. Shubhlakshmi Margekar, who is a very senior professor and a very able one also. And I will request her to carry out today's session. Dr. Shubhlakshmi Margekar, madam.
Thank you so much, sir. And thank you, Manjula ma'am, for this great opportunity. So I think we will directly start with the dummy questions first. As ma'am has already discussed the guidelines, so we will be moving on to dummy question so that we can practice what and how we have to do. So this is the Fever Quiz 2024. And first question, competency. So yes, this is the first question will be just coming, and you will have to, yes. So the question is, complete the line twinkle twinkle little dash, and your options are sun, star, planet, and moon. And your time starts now. So time is up. And Computer Ji, first we will have the correct answer. So it is star. So it is good to remember our old days with this rhyme. It was actually very much interesting rhyme, and everyone of us still remember it very nicely. So twinkle, twinkle, little star, how I wonder what you are.
Yeah,
So,
yeah. Correct. Still we remember
yes,
actually.
still we remember it. So let
First
us
dummy
see.
question. Let's see
Yes,
whether they
yes.
could play
Yeah.
it well.
Up
Yeah.
above the word so high, like a diamond in the sky.
Yes, correct.
So
Yes,
with
sir.
this, that all the participants are like diamonds, and they
Yeah.
should succeed in their life and their career also. Thank you.
Great.
Yes, thank
Great,
you,
sir.
sir, for that blessing words for the students. So, Computer Ji, if we
Good.
have a percentage, we can have. So, this is how you have to click to your correct answer, and the scoreboard will be
Good.
like this, and everyone has answered correctly. So, not only us, every one of us remember this rhyme. And who is the winner, Computer Ji? Yes. So, Dr. Sharma from Madhya Pradesh, Joyatram Hospital and Research Center. Very good. So this is how we have to play. Computer Ji, we can move on to second question quickly. Yes. So which is the national sports of India? Our options are cricket, football, hockey, and kabaddi. So your time starts now. Time is over. And Computer Ji, we can have the correct answer first. So it is hockey. So it is also a very important game. So we should be knowing, and it is our national sports. So we should be knowing about the hockey, and we have male team, female team, everyone knows that. So that is good. And Computer Ji, we can have the scoreboard so that our students are well versed how we have to play. I think everyone is able to answer it or click the options whichever is available in their
Text box.
text box. Yes.
So don't click on the image or video. Please click on the text box below. Hope
If there are
they could-
any problems anybody is facing, please let us know.
Yeah.
Right now, you can use the chat box or you can just message. So that will be better. Yes, back to text box. Dr. Shubhalakshmi, yes, please.
Yes. So that is important because this rummy question is for practice only. So if you are facing any problem, you can tell us. So yes, here also 90% of the answers are correct. Computer Ji, we can have the winner of this question. So Dr. Modi from Gujarat. So very nice, Dr. Modi. So moving on to our third dummy question. This is the last one. So where is the Taj Mahal located? And the options are New Delhi, Lucknow, Agra, and Mathura. Your time starts now. So the time is up. And Computer Ji, can we have the correct answer first? So it is Agra. And I think 100% of us would have answered it correctly. It is just a dummy question to know whether everything is working smoothly, your computer, your laptop, network, everything. That can be checked beforehand. So we can have the scoreboard in few seconds, and then we can move on to our next questions. So this is the last dummy question. Now we will be starting with our main quiz, where we will be having 20 questions. With every question will be having 4 options, and we have to click in the text box as we were doing in the these 3 questions. So whenever Computer Ji, we are, yeah. So still there is some confusion. So anyways.
No, maybe they're checking whether all options are working.
That may
This
be the
question
reason.
is on the South Zone thing, I think. It will be difficult to know that these are the all Western, northern cities. So
Okay.
Maybe.
West people should answer correctly now.
So, okay. So who is the winner for this question, Computer Ji? So Dr. Kamaria from Gujarat again. Okay, great. So this is all for the practice purpose. Now we will be moving on to our main quiz. So I hope everyone has checked everything and now we are well versed with. So Computer Ji, can we have our first question of the main quiz? Yes. So which of the following statement is false about Assam fever? Options are: Assam fever is another name for giardiasis. It is also called as dum-dum fever. Disease is also endemic in Calcutta and characterized by darkened skin. Your time starts now. Yes, so the time is up. I hope you all have answered it. So, Computer Ji, first we will have the correct answer and then we will be discussing. So, Assam fever is another name for giardiasis. This is not the correct statement. Rest all are correct. Let us see how and what is the another name or why we are not saying it is giardiasis. So, it is the name given to visceral leishmaniasis. It is also known as dum-dum fever, black fever, or kala azar. So it is a commonly known fever, but yes, Assam fever is a different one, and maybe the West Zone is not may not be aware of that this thing, and it is the fever which was occurred in 1880 and 1890 and resulted in thousands of deaths in district of Kamrup in Assam. So it is named like that. And disease gradually disappeared from there once the extensive use of DDT was there. Also known as black fever because of the characteristic darkened skin. That is why it is known as black fever. So this characterized by darkened skin option is also correct. And it was also seen or also found in Calcutta. Dum-Dum is an area which is near Calcutta. So it is also, and this option B and C is also correct. So A was the wrong answer and that you have to take. So let us see, Computer Ji, if we have the score. Yes. So according to the scores, 32% of the participants has answered it correctly. Rest, there was some confusion. I know because it was West Zone quiz. So we should be knowing about the conditions which are there in East Zone also. So Computer Ji, who is the winner for this question? Can we have? Okay. So Dr. Dikshit Kumar from Gujarat. Congratulations. And he has answered in 2 seconds. Very nice. So this is the opening of our quiz. So very nice. Congratulations. Moving on to the next question, Computer Ji. Yes. So what type of fever does the following graph in orange color denotes? Is it intermittent fever? Is it remittent fever? Is it stepladder fever? Or it is recurrent fever? Your time starts now. Yes, so time is up. Let us see first what is correct answer for this question. Computer Ji? Okay, so it is remittent fever. I hope the answer was locked. So we will be having some discussion about this remittent fever, why we are calling it as a remittent fever. As you can see in the graph, there were three colors. One is red straight line, and orange graph was above, black graph, and then black straight line. So this orange graph was not touching the baseline. As you can see in the graph, it was not touching the baseline. And so the remittent fever is a type or pattern of fever where the temperature does not touches the baseline and remains above the normal throughout the day. That is why we have labeled it as a remittent fever. And daily variation in the temperature is more than 1 degree in 24 hours, which also is the main difference as compared to the continuous fever. And it is commonly seen in various infections. Here, intermittent fever the fluctuation is between normal body temperature and the higher than normal, but it touches the baseline also. So this is the difference. And in step-ladder fever, the characteristic sign of a typhoid fever in which the temperature fluctuates between high and low and gradually increases in the stepwise fashion. So these were the options. So Computer ji, can we have this?
And Dr. Shubhalakshmi,
Yes, sir.
we can. There was a statement like fever comes down by crisis and the fever comes down by lysis. So that is a very old concept, but still relevant. The fever which comes down by lysis, we tell it comes in enteric fever. It doesn't come down and touches the baseline. The fever which comes down by crisis is seen in pneumonias, that when the patient responds, the fever will touch the baseline. So this was an old timer favorite question of the examiners. Dr. Sudarshan sir is with us. He must be aware of this, sir. So fever which comes down by lysis is enteric. Fever which comes down by crisis, we used to say it in pneumonia.
Pneumonia.
Yeah, yes, madam.
Yes, so very important point added by sir, and our students should be aware of this thing also. So as we can see, these are good number of students, 38% has answered it correctly. And let us see who has answered it correctly and quickly. So Dr. Parakh Jain, he is from SIMS Chhattisgarh. So that is good. Congratulations, Dr. Parakh. And he has answered in 4 seconds. So congratulations. Moving on to our third question, Computer ji. So which of the following feature are symptoms of chorioamnitis? Options are fetal tachycardia, antepartum hemorrhage, maternal bradycardia, or all of the above. Your time starts now. So the time is up. So first we will see the correct answer. It is fetal tachycardia. So actually the clinical findings are important to diagnose the condition, that is clinical chorioamnitis. And it is a broad spectrum of disease during pregnancy that is characterized by inflammation and or infection of intrauterine structure such as placenta, chorion or amnion. So the findings which can be seen are maternal fever, uterine tenderness, maternal tachycardia, fetal tachycardia, and purulent discharge per vaginum. So these are the symptoms which will be present. And the identification of the infectious etiology is very important to treat the condition, because if the treatment is not done timely, then the fetal and maternal outcome may be varied, and the fetal outcome or morbidity is there. It has seen in a significant number of cases. So Computer ji, can we have the scoreboard? It actually, yeah, please, Computer ji, can we have the scoreboard? We can have, yeah. So here we can see the number of students that I think 19% only have answered it correctly, and all of the above. So it is not like all of the above. If the option is all of the above, then the answer will also be the all of the above. So here this tukka is not worked, I think. So anyways, this condition is very important because we are dealing with antepartum patients, ANC patients also. So who is the winner of this question, Computer ji? So he is Himanshu Prajapati from Gujarat. So congratulations, Dr. Himanshu. And he has answered it very quickly in 2 seconds. Very nice. Congratulations. So Computer ji, moving on to our fourth question. Yes. So which statement about neurolept malignant syndrome is incorrect? Severe disorder caused by an adverse reaction to medication with dopamine receptor agonist properties. The abrupt cessation or reduction in dose of dopaminergic medication such as levodopa in Parkinson's disease may also precipitate NMS. The rapid switching from one type of dopamine receptor agonist to another in such cases have also been associated with NMS. NMS is also associated with lithium. Your time starts now. Okay, so the time is up. Computer ji, can we have the correct answer first? Yes. So answer option A is correct. That is, this was the incorrect statement. Rest of the statements were correct. So let us see what is the correct statement for this. So actually, neuroleptic malignant syndrome is a life-threatening condition where it is associated with dopamine receptor antagonist medication. Here the option was agonist. It is actually antagonist medication or with rapid withdrawal of dopaminergic medication that will lead to NMS. So this is how this option was slightly changed. And the very classical clinical characteristic include mental status changes, maybe patient in altered sensorium, irritable, fever, muscle rigidity, and autonomic instability are seen. Rest of the options like it is associated with lithium is correct. Rapid switching, as I told, can also lead to NMS, and abrupt cessation or reduction in dose of dopaminergic medication such as levodopa in Parkinson's disease can also precipitate NMS. So these were the options. So can we have the scoreboard, Computer ji? Yes. So we can see again there is a wide range of answer that have been given. So 24% of the students have answered correctly. Let us see who has answered it correctly. So Dr. Farooqi from Maharashtra, D.Y. Patil Medical College. Congratulations, Dr. Farooqi. And this was answered in 2 seconds. Very nice. So moving on to our next question, Computer ji. Fifth question. Yes. So based on the image, what is the diagnosis? And your options are scrub typhus, onchocerciasis, leishmaniasis, trypanosomiasis. Your time starts now. So let us see what is the correct answer first. So it is leishmaniasis. What we can see in this picture is important. So actually here what we are able to see is a lesion which is mainly ulcer, and it is seen in an exposed part. So here also we can see it is an exposed part of the body, and it is left in a scar which may be lifelong also. And this is there are 3 forms of the disease. Leishmaniasis can present in 3 forms that can be visceral, cutaneous, or mucocutaneous. So here we can see the cutaneous form of leishmaniasis, and visceral we all know is Kala-Azar. Mucocutaneous again lead to partial or total destruction of the mucosal membrane. And other options like scrub typhus, there we can see Ishar, that is usually seen not always in the open part, it can be seen in the covered part also. And the rashes are papular lesions, not always these type of lesion. And trypanosomiasis, canker is seen. And in case of onchocerciasis, the eye and skin involvement is seen. And there again, it is a itchy papule. So again, the scar will not be like this. And it can be vesicular, pustular or itchy lesion will be there. So the scoreboard, yes. So according to the scoreboard, option C was correct. That is 24% have answered it correctly. And 52, mainly everyone has thought to be a scrub typhus. But it was not a scrub because it is not usually seen in open or exposed part mainly. So scoreboard, please. Sorry, who is the winner? Okay, so Dr. Sharma from Madhya Pradesh is the winner for this. And I think this is the second time Dr. Sharma has answered it correctly. So very nice. But again, he has taken 5 seconds. So it was slightly difficult, I think. Okay, good. Congratulations. So moving on to our next question. That is question 6. So what should be the rate of fluid replacement in dengue shock syndrome? Your options are 7 to 10 ml per kg over 1 hour, 50 to 100 ml per kg in less than 20 minutes, 15 to 20 ml per kg in less than 20 minutes, or 20 to 40 ml per kg over 1 hour. Your time starts now. So the time is up and we can have the correct answer first. Computer please. Okay, so it is option C, 15 to 20 ml per kg in less than 20 minutes. So as we all know, this dengue shock syndrome is a very serious or critical condition where we have to act promptly. And the recommendations are, we have to initiate aggressive fluid resuscitation with an crystalloid fluid at a rate of about 15 to 20 ml per kg of body weight, infused in over 15 to 30 minutes. And afterwards, then we have to monitor the clinical status and then determine if there is improvement, we can reduce the dose. So if the shock signs are disappearing or you think the clinical status of the patient is improving, the fluid volume can be reduced to 10 ml per kg per hour for next 1 to 2 hours. And then again with the constant monitoring, we can again reduce if the clinical improvement is there, and the this infusion or fluid replacement can be reduced by 5 to 7 ml per hour over next 4 to 6 hours. So this is how we have to move, and it is very important to remember it because the time required and the time given by the patient is less. So we have to act promptly. Any of our members want to add something in this question?
Yeah,
I
Dr.
think,
Sublak.
yeah,
Yeah.
Dr. Ghanshyam, please
I
carry
think
on.
that ma'am have already said that this dengue shock syndrome, this is the most important thing we have to pick. This shock can lead to death and in dengue. Otherwise, dengue nowadays we are seeing less than 1% mortality. So this less than 20 minutes means it's a bolus dose. So you have to give 15-20 ml per kg bolus dose. If patient doesn't respond, you may have to repeat it again after maybe a 30 minutes or a 1 hour, and again see the BP, and maximum you can repeat up to 3 times. So 20 minutes is important. Rapid bolus dose is important. It's not an infusion, it's a bolus dose. Dr. Ramesh will like to add something.
Yeah, you very rightly said, Dr. Ghanshyam. That's what we want to reinforce. And another thing which is of importance here is the nature of the fluid. It is not that we just initially start with the colloids and skip the crystalloids which should be used. Crystalloids are like our NaCl and RL. So they are the first line of management. And when the patient is refractory to those, so then we pump in our colloids. Yeah, Dr. Shubha Lakshmi.
Thank you, sir, for adding.
Well, Dr. Ghanshyam and Dr. Ramesh have been part of the dengue task force, and Dr. Ghanshyam has evolved the guidelines for dengue. So that is one reason why he is very, I must say, interested, and he wants to enlighten everybody. Well, thank you, Dr. Ghanshyam.
Thank you, sir.
Thank you, sir. So, Computer ji, can we have the scoreboard? Yes, so we can see almost 41%, around 50% have answered it correctly, but still some confusion is there. So this confusion should not be there. So we should be well versed with the topic. So who is the winner for this question, Computer ji? So Dr. Tanuja from Gujarat has answered this question in 1 second. Very nice. Congratulations, Dr. Tanuja. So moving on to our next question, Computer ji. So what is the expansion of API with regard to malaria, which signifies the prevalence of malaria in a country? So your time starts now. Sorry. So option A is annual parasite index. Option B, annual plasmodium index. C, arterial plasmodium infection. And D, arterial parasite infection. Your time starts now. So the time is up. Computer ji, can we have the correct answer first? So it is annual parasite index. So in case of malaria, when we are talking about malaria and there comes API, it means annual parasite index. And what is it? It actually, the index is a ratio between number of cases reported and the population at risk per 1,000 population, per 1,000 people living in that area. And the higher the ratio indicates a more severe form of malaria problem is there in that particular locality. So it is very important to note malaria surveillance point of view, and to note the magnitude of the problem and to plan a strategy according to it, so that preventive strategy can be planned. And because these tropical fevers are very common in this part or our India, so it is very important to know about these index and to plan the preventive strategy, which area is to be covered in for preventive strategy can be planned according to the annual parasite index in case of malaria. So it is mainly
Dr.
done.
Dr.
Yes, sir.
Subbalakshmi, I think you can ask Dr. Sudarshan, sir,
Sudarshan.
who is the
No,
pioneer in
no, I think,
It's all
yeah.
about
So
this
this is-
infection.
Yeah, this is
Sir.
a basic epidemiological indicator that is used to classify the areas for malaria endemicity, and also to strategize various interventions based on the API. So, but actually this is from community medicine, but anyway, I am happy to see that it is figuring in internal medicine. Back to the quiz team. Thank you.
So Computer Ji has specially chosen this question for you.
Thank you, thank you.
So,
Thank you.
Computer Ji, if we are any member want to add anything more? Okay, so this is from community medicine, but our students have read it properly. So actually 62% of the students have answered it correctly. Very nice. So who is the winner for this question, Computer Ji? So Dr. Rahul from Gujarat, he has answered this question in less than or 1 second. Very nice. So actually it should be known to plan the strategy of prevention and all. So congratulations. Moving on to
a lot of students are from CU Saha Medical College, Gujarat.
yes,
They are coming, good numbers of podium initially.
yes.
You should note that CU Saha Medical College. Thank you, sir.
Okay. So Computer Ji, can we have the next question? That is 8th question. So which of the following medication is not commonly used in the treatment of acute rheumatic fever? Options are penicillin, NSAIDs, corticosteroids, or antibiotic targeting gram-negative bacteria. Your time starts now. So the time is up. Computer Ji, we can have the correct answer first. Okay. So this antibiotic targeting gram-negative bacteria is not commonly used in the treatment of acute rheumatic fever. Rest all, that is penicillin, NSAIDs, and corticosteroid is used for the treatment of various conditions in acute rheumatic fever. So as we are all aware that arthritis, management of arthritis in case of acute rheumatic fever, patient have severe pain in the joint, and for that we have to give anti-inflammatory drugs for the treatment, symptomatic management of acute arthritis that patient is having. For that, we have to add non-steroidal anti-inflammatory drugs that can be naproxen, ibuprofen, or any other. And glucocorticoid or corticosteroid can be used in these conditions. For antibiotic point of view, so sore throat and symptoms suggestive of streptococcal infection, there we have to give antibiotic. So penicillin is the treatment which is opted for this to take care of the upper respiratory tract infection. But yes, gram-negative bacteria covering antibiotic is not used in the treatment of acute rheumatic fever, this thing. So can we have the scoreboard, Computer Ji? Yes, so we can see here we can see 39% of the students have answered correctly. But yes, there was confusion. So all the options have been ticked by some or the other student. So this confusion should be slightly less. So I think we should be reading more about these type of condition, which is there in India, which we are treating, which we are facing. So Computer Ji, can we have the winner of this question? So Dr. Shyam Patel from Gujarat Again, sir, he is from CU Shah Medical College and Hospital. So he has also taken only 1 second to answer this question. Very nice. So Computer ji, moving on to our next question of this quiz. So it is the 9th question. It will be the 9th question. So a case scenario, 36-year-old man with HIV/AIDS with CD4 count of 112 per microliter develops a scaly, waxy, yellowish, patchy, crusty, pruritic rash on and around his nose. The rest of his skin examination is normal. So which of the following is most likely diagnosis? Molluscum contagiosum, psoriasis, reactivation of herpes zoster, or seborrheic dermatitis? Your time starts now. So time is up. Computer ji, can we have the correct answer first? So it is seborrheic dermatitis. So as we know, this HIV/AIDS or patient who are positive for these conditions, dermatological problem occur in about 90% or more than 90% of the patient with the HIV infection. And seborrheic dermatitis, as you can see, is answer here also, is perhaps the most common rash in HIV patients, which we usually don't get many times because these patients may present directly to the skin clinic or dermatological department. So, but it is present very commonly. Almost 50% of the patient may have these type of rashes. Molluscum contagiosum, coming to the other lesion one by one. So you can see other options like psoriasis. It will have a scaly lesion. It will not be yellowish or pruritic. So the characteristic will change, and the shiny, scaly, whitish lesion will be there in psoriasis. And for molluscum contagiosum, the itchy bump-like lesion will be there and can involve face, abdomen, upper thighs, and genitals. And reactivation of the herpes zoster. So there you have a group of cluster of lesion, which will be pustular type of lesion. So the characteristic of lesion will decide or can be helpful in this MCQ. So Computer ji, can we have the scoreboard? Yes. So we can see 41% of the student have answered it correctly. And let's see who has answered it correctly and quickly. Computer ji? Yes. So Dr. Prakhar Jain from SIMS Chhattisgarh has answered it correctly and within 1 second. So quickly, very quickly. So very nice. Congratulations. And now moving on to our next question. That will be the 10th question. That is, we will be halfway the quiz. So Computer ji? Yes. So the 10th question is, which of the following clinical feature can be used to rule out malaria in favor of another tropical febrile illness in a returning traveler? So options are diarrhea, lack of paroxysmal nature of the fever, severe myalgia and retroorbital headache, or none of the above. Your time starts now. Okay, so the time is up. And Computer ji, can we have the answer first? So it is none of the above. So we can see all the options like diarrhea, lack of paroxysmal nature of the fever, and severe myalgia and retroorbital headache in a patient who is returning traveler. So all febrile travelers returning from or immigrant arriving from Plasmodium falciparum endemic region should be assumed to have infection with the most severe form of the malaria until proven otherwise. This is very well known. And if it is there, it is the most common infection and may be fatal if not treated timely. So for that reason, it is assumed. So the features like diarrhea, it is present, lack of paroxysm in nature of fever. So ideally there should be paroxysm, but it is not always there that paroxysm is present in this Plasmodium falciparum malaria. And other features like severe myalgia and retroorbital pain, retroorbital headache, these are also present in a case of traveler with Plasmodium falciparum. So any of our members want to include anything to this? Yes.
Dr. Sublakshmi, I would like to add that this question is very important because it's very common in Indian setting and travelers also. This classically says that even malaria can present as diarrhea also, and this is written in WHO definition also. So if person has diarrhea, it doesn't mean that patient may not have malaria. And like severe myalgia, retroorbital pain, we say it's a dengue or any other viral infection, but still it can still be a malaria. So you should rule out, and it's a treatable condition, easily treatable. If you miss, patient may die. In analogy, like we said, we say that tuberculosis can present like anything. So similar is like malaria, any sick patient, altered sensorium, diarrhea, non-atypical symptoms, you should suspect malaria, especially if person is coming from an endemic endemic region visit. Therefore, the answer is none of the above. So you cannot rule out with any of the atypical symptoms. So always remember, malaria is one of the cause and one of the deadly cause of these fever as well as non-febrile symptoms.
Yes, sir. Thank you very much. So any condition where there are atypical symptom, it is high index of suspicion which is required for the diagnosis. So Computer ji, can we have the scoreboard? Yes. So none of the above. 36% of the students have answered this option, and others still think that diarrhea and other condition can be ruled out. But as we have just discussed, it cannot be ruled out. So Computer ji, can we have the winner for this question? So Dr. Rohan Garg from Netaji Subhash Chandra Bose Medical College, Madhya Pradesh. Congratulations, Dr. Rohan. He has answered it in 1 second. So with this, we have completed 10 questions. That is half of our quiz is done. So I hand over to Dr. Manjula ma'am for...
Yes, ma'am. We will have a score at when we complete 10th question. So
Yes, yes.
Computer ji, can we have the score to show how the scoreboard is looking like after 50% of the quiz questions have been completed? If you
So
are
that
ready, can you show?
rest of the student can be more quick in answering the rest of the 10 questions. They are still having 10 questions to go.
Yeah, but because all of them have, except one person, what I was noting down,
Yes,
all are have answered 1-1-1-1. So let's see.
yes, yes, let's see. So yes, you are correct, ma'am. Absolutely correct. Dr. Prakhar Jain has scored 2 correct answers. Rest have 1. So never mind. The 10 questions are still there to go. So let's be quick in answering, more quick. So
Yeah.
because many of them has answered in 1 second only. So I don't know how.
There may be a tiebreaker this time.
Chances are very high.
Yes, sir. Yeah,
Everyone has almost equal chances of winning. Still.
exactly,
Yes.
exactly. It's as good as we have just started.
Vertically, it is 10. That is also we need to check.
Sir.
That is why we have expert jury with us, sir.
Yeah,
Yes,
jury has
yes.
its own.
My job is that. Yeah.
Jury
Sir,
has an eagle eye.
Computer ji is correctly calculating or not.
Yeah.
Good computer.
Okay. Yeah, we
So,
can
should we
have the.
move, ma'am? Yeah. So, Computer ji, we can move to our 11th question. So, which of the following are the diagnostic method for dengue? RT-PCR, nucleic acid amplification test, enzyme-linked immunosorbent assay, or all of the above? Your time starts now. So, time is up. So, Computer ji, can we have first the correct answer? So, it is all of the above. I hope all the students, I think 100% should have answered this correctly, and they should answer it correctly because, and again, this is question regarding dengue. This is, I think, second question in this quiz. So, it is very important topic. So, reinforcement means you should be knowing each and everything about this infection. and it is like RT-PCR, NAT testing, ELISA testing. So this is not the which one is used. It is like all are the diagnostic method which can be used for the diagnosis of dengue fever. So any of the jury member, any of the members want to add anything for this question?
Yes, I think dengue is important for Indian subcontinent. And as Dr. Subbulakshmi has already told, this all tests are done for dengue, but which test to be done, that is important to know for student as well as physician. So RT-PCR, I think it's very rarely used because it's not available in routine laboratory. But we should know that it is to be done in initial 5 to 7 days only. So if you do after maybe 7 days, 10 days, it will be negative. So similarly, nucleic acid amplification test, which is like another type of a nucleic acid direct test, or NS1 antigen can also be detected by nucleic acid amplification. So that also has to be done in initial phases, while ELISA test will take after 5 days. So if you do ELISA test, especially for IgM antibodies, so you will get negative test. So initial 5 days, you can detect directly antigen or a nucleic acid, while after 5 days, you have to do an antibody test. So you students should remember that which test to be done. And we have both the tests available. NS1 antigen for initial 5 days, and after 5 days, we have IgM ELISA test.
Yes,
I
very
think-
important point have been pointed out, because in emergencies or in our setting where we go for NS1 antigen, which we want quick result. So we go for that, and initial days that will only be positive. So Kampriji, if we have a scoreboard ready, we can go with that. Yes. So here we can see the option is 55% have answered it, all the above. Still there is some confusion, sir. So they need to read dengue again, I think, because the season is about to come. So they should be well versed with the condition now. So, okay. So moving, let's see who is the winner for this question, Computerji. So Dr. Rohan Garg from Netaji Subhash Chandra Bose Medical College, Madhya Pradesh, again answered in 1 second. Very nice. Congratulations, Dr. Rohan. And Kampriji, moving on to our next question, 12th question. Yes. So a 47-year-old woman presented with a fever and rash that extend to her palm and sole. After additional history and physical examination, the patient is promptly admitted due to the high mortality rate associated with the presumed causative agent. Which pathogen is likely responsible for the patient's disease? First is chikungunya, second is Coxsackie A16, C is enterovirus, and D is rickettsia. So let's see which is the option. Computerji, your time starts now. So the time is up, and Computerji, can we have the correct answer first? So it is rickettsia. Here we can see the patient presented with fever and rash that has extended in her palms and soles. And then the treating physician has suspected something, and then they have admitted the patient. So here is the option. So all the options, whichever is there, like chikungunya, Coxsackie virus, enterovirus, so these all present with rashes. Rashes with fever can be seen in all the patients, but like we can see in chikungunya, fever which is transmitted by mosquito bite and is subtropical region, it is present and associated with maculopapular eruption along with the fever. And severe polyarthritis, small joint arthralgia are seen. And now also we can see, or we can know the history of chikungunya. Many patients tell ki once upon a time there was chikungunya 2 years back, 3 years back, and after that they have joint pain and various pains in the body. So this is how it presents. But rickettsia, here you can see the agent which is very fatal, and additional history and physical examination added they have observed the rashes in the body, which was suspected to be of a rickettsial origin, and the cause can be Rocky Mountain spotted fever, which will be leading to this type of rash, and it spreads by tick and throughout and can be present and typically manifest as rashes that begins on the wrist and ankle and spread centripetally. So first in the wrist and ankle and then centripetally, and the rash appears in palm and sole later in the disease, and lesion display evolution from the blanchable macule to the petechiae can be seen in these type of patients. So because it was present in the palm and the sole, the diagnosis was towards rickettsial fever. So Computer Ji, can we have the scoreboard? So the option given by the students are Coxsackie, but the option was D, that is rickettsial fever. Computer Ji, can we have the correct, the winner of this quiz? Okay, so Dr. Farooqi from Maharashtra has taken 2 minutes to 2 seconds to answer this question. 2 seconds to answer this question. That is very nice. So slightly confusion was there because rashes is present in all of the options. So any member want to add anything, or we can proceed with the next question?
Dr. Sublakshmi, I think it's a difficult question for PG because Rocky Mountain fever is not very common in, I think, Indian setting.
Yes.
Also, but rickettsial infection, they say it's very severe and can be fatal up to 70% of the patient if not treated well. And as Dr. Ramesh also told yesterday, that these infection can be treated with atypical antibiotic like doxycycline that can be life-saving. So you should suspect this if someone has a fever and has a exposure like in environment, someone going to a forest and all, and in outside going for a camping and all. So these rickettsial infections are still common in Himachal Pradesh and all these hilly regions. So some cases do come there. But other than that, I don't think West India or South India, this is so common. So they may not have seen any cases in their setting. But the good thing is, this question was lesion in the hands and palms, soles and palms. That can pick you that it may be a rickettsial infection. So, but rare to see and difficult to answer. Really, I would say rare disease for Indians, but American is very.
But Dr. Ghanshyam, the other choices they can rule out.
Yeah.
Chikungunya doesn't present with these things. Enteroviruses, they do not present with the rashes on the hand. So as far as the competition is concerned, the answers are generally done by excluding the other choices. Sometimes you know, sometimes you do not know, sometimes you guess, as the students do in a quiz. So
yes,
anyway.
Exactly. There's written a high mortality. So chikungunya is rarely,
rarely associated.
Rare. So exactly, they
Yeah.
have written very classically stem is made, no mortality or rare.
Yeah. Yes. Big boss is there. He will
Yeah,
answer.
Computer Ji is the boss. Yeah.
Yeah, and importantly, it is important for all to understand that lesions in the hands and soles, peripheral lesions, there are very few differential diagnoses. One was monkeypox. Earlier is an extinct disease like smallpox. And there are diseases like RMSF, Rocky Mountain Spotted Fever, which can actually present to you with lesions in hands and soles. Also, one more disease which has had a resurgence is secondary syphilis, which can also, you can have these palms and soles which are there. This is very important. In fact, people give a differential of hand, foot and mouth disease, which is not a classical peripheral disease. It is a very self-limiting disease. But serious diseases, you should think of secondary syphilis, Rocky Mountain Spotted Fever, monkeypox, which was there surprisingly. So newer events and a resurgence of disease like smallpox, which is now extinct, but yes, similar category of diseases. These are very important as a differentials when you have lesions in the hands and soles. Very important.
Yes, thank you, sir. Thank you everyone for adding information in this question to the students. And winner for this question is Dr. Farooqi again. So congratulations, Dr. Farooqi. You have answered this question in 2 seconds. Very nice. So moving on to our next question, that will be 13th question. Which of the following diagnostic test would be most specific for differentiating between a bacterial and viral cause of the fever? A, C-reactive protein, B, erythrocyte sedimentation rate, C, procalcitonin, and D, white cell blood cell count. Your time starts now. So the time is up. And Computer ji, can we have the correct answer first? Yes. So it is procalcitonin. I think it was an easy one, and student must have answered this question 100% correctly. So we can see C-reactive protein, erythrocyte sedimentation rate, and these are all acute phase reactant, can be raised in any inflammatory condition, but viral fever will less likely to cause increase in these and acute conditions. Like viral fever will less likely to cause increase in C-reactive protein or erythrocyte sedimentation rate or white cell count, because white cell count may be raised, may be low or may be normal. So this is how we, by choice of exclusion, we can see which is the answer. So as you all know, this procalcitonin, a protein that consists of amino acids and is peptide precursor of calcitonin, a hormone that is synthesized by the parafollicular C cell of the thyroid and involves in calcium hemostasis, and is raised or is increased in bacterial infections or fever that is associated with bacterial infection. So Computer ji, we can have the scoreboard if it is ready. So again, 45% of the students have answered it correctly. So who is the winner for this question, Computer ji? Dr. Farooqi again from D.Y. Patil Medical College, Maharashtra, and he has taken 1 second to answer this question. That is very nice. Congratulations, Dr. Farooqi. And moving on to our next question, Computer ji. So this will be the 14th question. Maculopapular rashes is seen in all except. Options are measles, meningococcemia, infectious mononucleosis, or rubella. Your time starts now. So the time is up, and we can have the correct answer first, Computer ji. So the option is meningococcemia. We all know that rashes are there in all the conditions which is mentioned here, like measles, infectious mononucleosis, rubella, and meningococcemia. But the question was maculopapular rash. So in meningococcemia, what we find is petechial or pruritic rashes are seen. Other conditions like meningococcemia, dengue fever, where also we can see these type of rashes. Other condition like maculopapular rashes, these are seen in measles, rubella, dengue. These all are condition where we can see maculopapular rash, except for meningococcemia. So, Computer ji, can we have the scoreboard? So rashes are present, but yes, the type of rash is important in this question. Which type of rash is present in which condition? So the other conditions, which are 3 conditions which are mentioned, will cause maculopapular rash. And yes, so according to scoreboard, answer given is C, but the answer was B, and 19% of the student have answered it correctly. So Computer ji, can we have the student with correct and okay. So Dr. Tanuja from Gujarat has answered in 1 second. So congratulations, Dr. Tanuja. Now moving on to our next question, Computer ji. This is, which of the following are associated with typhoid fever? So options are rose spot, erythema multiforme, sweet syndrome, or all of the above. So your time starts now. So time is up. So Computer ji, can we have the correct answer first? So the answer is all of the above. So rose spot, erythema multiforme, or sweet syndrome. These all can be seen in this typhoid fever. So as we all know, rose spot, it is described as a rash that occur in up to 30% of the people infected with enteric fever. And the bacteria, apart from rose spot, other rashes may arise in the infection like erythema typhosum, a generalized rash can be seen. Hemorrhagic bullae can be seen. Pustular dermatitis can be seen. Erythema multiforme is seen, or Sweet syndrome. What is Sweet syndrome actually? It is called acute febrile neutrophilic dermatomyositis. This is also seen in patients with enteric fever. Other symptoms which are present in this syndrome are acute onset tender plaque or nodule, fever, arthralgia, ophthalmological manifestations, headache, and rarely oral or genital region. So these all conditions can be seen. So let us see how what is the scoreboard for this question. Computer ji. Computer ji, can we have the scoreboard for this? So again, very important to note, because this any of the member want to add anything?
I think we had a lot of discussion yesterday on erythema multiforme,
Yes, sir.
erythema gyratum, erythema marginatum, and Lyme's disease and those things. So
Yes.
we are ready with the scores.
Yes. So the option, correct answer was option D, and 42% of the students have answered it correctly. So again, many of the students think it is rose spot only that is present or associated with typhoid fever. But yes, other type of spots are, or other type of rashes are also seen in cases of typhoid. So who is the winner for this question, Computer ji? Dr. Mihir Chaudhary from Gujarat. So congratulations, Dr. Mihir. And he has taken 1 second to answer this question. Very nice. Congratulations. And Computer ji, we can move on to our next question. That will be the 16th question. So HIV-associated nephropathy is linked with which histological subtype of glomerulonephritis? A, collapsing variant of focal segmental glomerulonephritis. B, focal glomerular sclerosis. C, proliferative variant of focal segmental glomerulonephritis. And D, mesoscapillary glomerulonephritis. So your time starts now. So, Computer ji, can we have the correct answer first? Then we can discuss a bit. So, it is collapsing variant of focal segmental glomerulonephritis. So, we know that HIV-associated kidney disease has been classified into 3 different groups. It is also not very uncommon. And these groups are HIV-associated nephropathy, also known as HIV-associated focal and segmental glomerulosclerosis, or glomerulonephritis, hemolytic uremic syndrome, HIV-associated immune complex renal disease. So these are the conditions which are associated with HIV-associated nephropathy. Among HIV-associated kidney disease, this focal segmental glomerulonephritis is the commonest which is seen, and HIV-associated nephropathy can occur in any phase of the HIV infection, including acute seroconversion, but is usually seen later in the disease where the viral load is higher. So it is important because kidney involvement in HIV is a condition which we should be aware of, because many patients come with deranged renal function, or they usually present with conditions like nephropathy, like nephrotic syndrome and all. So we have to be aware of that. Computer ji, can we have the scoreboard for this question? So answer is 83% of the student have answered correctly. Very nice. So this collapsing variant is very important to note, because this is the variant which is most commonly seen in HIV-associated nephropathy. So Computer ji, can we have the winner for this question? So again, Mihir Chaudhary, nice, from Gujarat, has answered within 1 second. So congratulations, Dr. Mihir. Again, moving on to our next question. So this question is, yes, a 50-year-old male present with fever, chills, and generalized maculopapular rashes after hiking in a wooded area. Which of the most likely diagnosis? So option A is Rocky Mountain spotted fever, Lyme's disease, ichthyosis, and babesiosis. So your time starts now. So the time is up. Computer ji, can we have the correct answer first? So it is Rocky Mountain spotted fever. Slightly overlap of the question. And I think many of the students might have answered this question actually correctly. So why it is Rocky Mountain fever? We can see that fever, chills, and generalized maculopapular rashes, which were present in presentation. And after hiking in a wooded area, as in the previous discussion only we have just discussed, forest area, hilly area, wooded area, if the patient has a history of moving around that area or is living around that area, then these type of this fever is likely to be a cause. And again, it is not very much common in India, but yes, we should be aware of. And if there is exposure of these patients to any hilly area or forest area, then the diagnosis should be kept in mind in dealing with any patient with fever and rash. So, Computer ji, can we have the scoreboard for this question? And as we have just discussed, atypical fever, doxycycline is a treatment of choice in this case. So again, 45% of the student have answered it correctly. But it was actually the overlap of the question. Then I think the student have not picked the hint given in the previous question also. Dr. Ghanshyam sir has very this thing pointed that woody area will be hint to the history of patient with Rocky Mountain fever. So, Computer ji, can we have the scoreboard for this question?
Winner.
Yes, sorry. Yes, so, Dr. Modi from Gujarat, he has answered this question in 1 second. So, very nice, Dr. Modi.
Nisarg Modi.
Nisarg Modi.
Yeah,
Yes.
yeah. Modi from Gujarat means something else also. Thank you.
Yes, Dr. Nisarg Modi. Okay, sir.
Dr. Nisarg Modi, sir.
Modi, yeah.
Okay, so moving on to our next question, that will be 18th question for this quiz. All of the following statement regarding Aspergillus fumigatus, termed as white fungus, are correct, except a common laboratory contaminant. It can easily spread from person to person. The common cause of fungi-related asthma, the major cause of systemic mycosis. Your time starts now. So the time is up. So the question was, which of the following is not, or it is not correct? So the option, Computer ji, can we have the option first? Correct answer first. So it can easily spread from person to person. So it is not correct. So the statement like it is a common laboratory contaminant, it is a common cause of fungi-related asthma, and it is a major cause of systemic mycosis. So this is what white fungus is about and how it is spread. So it is its spore are present in the atmosphere and everybody inhales and the several hundred spore each day. So typically these are quickly eliminated by the immune system in the healthy individual. So if the patient is immunocompromised or the immune system is not up to the mark because of any comorbidity or illness, the fungus is more likely to become pathogenic in these patients, overrunning the host weakened defense and causing a range of disease generally termed as aspergillosis. So, Computer ji, can we have the scoreboard if it is ready? Yes. So, here B option was correct and 38% of the student have answered it correctly. So, very nice. Let us see who has answered it quickly. So, Computer ji, can we have the winner for this question? So Dr. Bhojani from Gujarat, he has answered the question in 1 second. So congratulations, Dr. Bhojani, and he is new entry to this winner list. So congratulations. And now, Computer ji, moving on to our next question. That is, which genetic mutation is associated with periodic fever syndrome, such as familial cold autoinflammatory syndrome? So your options are NLRP3 gene mutation, TNF RSF1A gene mutation, MEFV gene mutation, and NOD2 and CARD15 gene mutation. Your time starts now. So your time is up, and first we can have the correct answer, Computer ji. NLRP3 gene mutation. Let us see what is this FCAS, or familial cold autoinflammatory syndrome. So it is a milder end of the spectrum of cryopyrin associated periodic syndrome, that is CAPS. And the flare of familial cold autoinflammatory syndrome are triggered by cold exposure and present with low-grade fever, polyarthralgia, and urticarial rashes, and often start with 2 hours of cold exposure and last 12 to 48 hours. And other common features include conjunctivitis, profuse sweating, dizziness, headache, nausea, and also seen in these conditions. And this mutation, that is NLRP gene mutation, is seen in this familial cold autoinflammatory syndrome. It is not very common, but yes, it is one of the syndrome which is present. So the scoreboard says option A, that is 38% of the patient has student have answered this question correctly. And let us see who has answered it quickly. So, Computer ji, can we have the winner for this question? So it again is Dr. Mihir Chaudhary. So congratulations, Dr. Mihir. He has answered this question in 1 second. So very good, very great going. So Computer ji, can we move on to our next question? So this will be the last question. Yes, sir. This will be the last question of this quiz. Which of the following is least likely to cause a lobar pneumonia? Options are Haemophilus influenzae, Klebsiella pneumoniae, Legionella pneumoniae, and Pneumophilia, and Pneumocystis jirovecii. So your time starts now. So time is up, and Computer ji, can we have the correct answer first? So Pneumocystis jirovecii is the correct answer. That means it is least likely to cause lobar pneumonia by the Pneumocystis jirovecii. Otherwise, Haemophilus influenzae, Klebsiella pneumoniae, and Legionella pneumophilia can cause or will cause lobar pneumonia if any person is infected by these organisms. So what is this Pneumocystis jirovecii? We all are aware that the symptoms usually include dyspnea, non-productive cough, fever, can be seen in immunosuppressed individuals, and usually the lesions are bilateral. Bilateral involvement is there, and infiltrates are seen in radiograph. Extrapulmonary involvement can also be there in these cases, like lymph node, spleen, liver, bone marrow. These all can be involved in cases of Pneumocystis jirovecii. So, Computer ji, can we have the scoreboard? Yes. So the options. Okay, so 71% of the student has answered it correctly. So they have read the topic nicely, and that is good. So can we have the winner for this question, Computer ji? So again, a new entry, that is Dr. Prabodh Sardar from Maharashtra, IGGMC Nagpur. So congratulations, Dr. Sardar. he has answered the question in 1 second. So very nice. So with this, we come to end of question 20 of this quiz. So
We'll wait for them to complete. So I
Compile.
think it appears there are ties because I was also entering here. So Dr.
Mm.
Sudarshan sir has will active role will come now. So let them tell, because today I was noting down all the numbers also along with the computer G. So there's a clear tie.
Madam, I have a question, of course. Chhattisgarh in West Zone, something just look at it, look at it, look into it. I don't know.
Yes.
Yeah, Chhattisgarh in
Yeah,
West Zone.
I will check, sir. I'll check.
Yeah, please. Yeah, this type of observations I'll be making. Yeah.
Jairaj sir,
Yeah.
if you're there, or Girish,
But they don't have a
what is the
central zone.
reason? Anything you would
They
like
have
to
a
say?
central zone, so I think they have like central.
They don't have central zone, so they have put it on the west. We don't have central now, so that's why they have been.
Just
We had
attach to what they
discussed
put in.
actually that
Correct.
earlier.
Yeah, next time we should be taking this up. Yeah.
We will have to see the Ranji Trophy.
Yeah.
So that
No,
will be-
actually, we
I
go as
also-
per our geography of coverage, in fact, but ideally
Yeah.
we should be looking at
For us also, Chhattisgarh comes in West Zone, probably it
Yeah.
has become right. Okay.
Yeah, right.
So the questions were bit tough. Yeah, let me be honest. It was difficult today because I'm there since 3 days. But anyway, you see, that's why all that distribution 20, 40, 20, 20, like that. So it was not 80, 20, some like
Correct.
that. So they were all having difficulty. No, it's okay. It is uniform. See, sometimes the paper may be tough. We have gone through all this in our examination. It need not be easy or moderate.
Yes, so there were no
That-
ambiguity in answers, I think.
Yeah, as far as the
Tough is
questions, difficulty index, yes. But otherwise,
The
everything
questions
was-
may
yeah.
have been tougher today, or the questions in the last two rounds may have been easier.
Yeah. No, I told you, if compared to.
And we should have one question from preventive medicine. And
No, it was there. API was there. API was there.
every quiz we should have one.
Yeah. It was there.
But tomorrow we will have to take care of that.
So they're scoring. They need another 2 minutes to
Yeah.
compile and show us. So
Yes. So tiebreaker may be for first position or second position, either.
I think both. I according to me, I don't know. Let the computer see. So that's why I asked Dr.
Oh.
Sudarshan sir has to tell how to do according to what I've written manually. But let
Let
them
us see.
let us see the computer
yeah.
generated.
Otherwise, other way around is we can see number of correct answer also after fastest finger first. So there we don't have to go for a tiebreaker. Next time.
No, sir. Then I will tell you why it can't be. Because
Okay.
more time they will have option of looking into internet and answering. So that's why we went to this mode.
Or negative marking for wrong answering.
So we have two toppers. So that means first and second.
Yes, sir. There is
So
a
you have to
typo.
have only one tiebreaker between the first.
First and second both will be winner.
Yeah.
We don't have to do tiebreaker.
Yes.
I don't think we have to do tiebreaker.
Sudarshan sir.
Yeah, I think we can go with
Both winner.
first and second as
Both first. Sir.
two from West Zone. That's all.
Both are winner now. There's no
Yeah,
run.
both are winners. Serial number, that is Hassan Faruqi and Mihir
Dr.
Chaudhary. Yeah,
Yes.
two from West Zone will go to the finals. Yeah.
Yes. Sir. No tiebreaker.
Right.
Okay, sir.
So no super over.
Computer G, can you make Ahan Faruqi and Mihir Chaudhary? Both have got equal. So both of them will qualify to the final. So no tie breaking round. That's what, correct, sir?
Yes, right.
Correct.
Yes. So both of them will qualify. So I think Dr. Hassan Faruqi from DY Patil and Mihir from CU Shah.
Okay.
Congratulations to both the winners. Yeah.
Yeah, but this was really tough, sir. Everyone is played. I know the difficulty level was there, so that's why I think everyone was everyone attempted actually.
Maybe it's like a F1 race. Number of podiums we are counting, and
Good.
also we are counting the.
Good.
Yeah.
So can the computer
Thank-
ji, can you announce the winners
Yeah.
officially?
Curtain.
Cut.
curtain.
Curtain, right, sir.
You will announce the prize after the winners are announced.
Yes, sir. Definitely after that, sir, Madam will be announcing.
And no, they all come for the finals. So
Yeah.
then they will participate in the finals. No, sir, that time.
Yeah.
So I thank everybody, and I will join again tomorrow. I have some
Thank you so much, sir.
urgent work. I
Really, it
need
was
to
so
leave. Yeah.
so pleasure, and
Yeah,
thank
yeah.
you
No,
for
no,
helping us.
I'll see the names and then I will immediately log
Yes,
out.
sir.
Over. Yeah.
Okay, sir. Thank you. Thank you, everyone also.
See you again tomorrow. Thank you. Bye.
Thank you, sir.
Ma'am, same here. I'm driving. So Girish, Mr. Girish can give the vote of thanks.
Yeah,
Girish?
Right.
yeah.
Thank you, sir. Thank you, sir.
Yeah.
So result of West Zone is there, ma'am. You will have to announce it. Yes.
Your partner. Okay, good.
So congratulations, Dr. Ehsan Farooqi from DY Patil Medical College and Dr. Mihir Chaudhary from CU Shah Medical College, Gujarat, and DY Patil from Maharashtra. Congratulations to both the winners and all the participants who have participated and played so nicely.
So very good, ma'am. Congratulations to the winner, Dr. Farooqi and Dr. Chaudhary. So you will be coming for the finals national championship so along with the winners from the other zone. It will be in November during FEFCON. Fever Foundation team will contact you and gives you all the detail. And I also congratulate Madam Sina, all the participants who really beautifully played. Maybe 2 winners, but every one of you are winner, and all of you will get a participation certificate for having participated in the quiz program. And I also mentioned, please submit your posters for poster competition as well. 10 September is last day. Details will be sent to your department and will be notified on your notice board. So over to Dr. Anupam sir, quiz host, before we close.
Well, thank you, Dr. Manjula. Congratulations, all the participants, especially the winners, and we look forward to having them over for the FEFCON conference. And thank you, Dr. Shubhlakshmi, Dr. Ghanshyam, and Dr. Ramesh, and the FEFCON team. Dr. Sudarshan has just left. We owe a great deal to him. He is the quiz the person quiz jury, and it is important for him. And the RX events team and Deepika, thank you so much. And all the best participants, look forward to having you and your juniors next year also from the West Zone. Thank you.
Thank you, sir. Thank you very much, sir. Thank you, Subbalakshmi Madam, Dr.
Thank
Ramesh Agarwal, and Ghanshyam Pandey, and
Thank you.
Anupam, sir. Thank you very much. Over to Girish for final comments.
Yeah, I think not to repeat the things. Congratulations to all the winners, all the participants, and of course our FEFCON members and all the juries. And Shubhalakshmi ma'am, I think special thanks to you. So coolly you've taken it around 1 hour plus of the quiz. So softly you've taken it up. And thanks to Dr. Manjula, because she has been with every event and every evening. I think she's spending time with all this. A lot of good preparations from them. And this is just the beginning, but I think poster presentation also an important event for us. And we pick a lot of, I think, ideology from the juniors and on fever, and we do take up those the findings from you, and we also utilize in our day-to-day usage in our promotion of products. So otherwise, thanks for RX events. Thanks to Deepika and Praveen to make it happen. And of course, we'll be waiting to meet you all in the finals, the winners, and there'll be a grand finale for you to face the quiz. So good night, everyone.
Thank you. So thank you, Deepika, Atharva, Praveen, and RX team. Thank you all. Namaste.
Thank you.
Thank you all. Thank you.
Thank you, madam. Thank you.
you, everyone.
Thank you, sir.
Bye. Good
Well,
night.
thank you, sir. Thank you.
Bye.
Thank you, ma'am. Thank you.
Thanks.
Bye, sir.
Thanks.
Bye, Jared, sir. Bye, sir. Thank you.